Thank you very much for the introduction. I would like also to thank Pierre Farb for inviting me to participate in the session. Yes, we usually meet in a place that is sunny, but a little bit less hot or humid as compared to Singapore, but nonetheless, this is truly a very nice venue for the meeting. So the topic that I'm to cover for the next 10-15 minutes or so is on photo protection, how to be safe, which is sunscreen assessment family experience, which is a survey that had been done recently. This is the result of an old project covering all skin types, all skin color, as well as the various type of photodermatosis. So the rationale for photo protection, speaking to a room full of dermatologists, we all know that there are significant side effects of sun exposure, especially with chronic sun exposure, that results in photocarcinogenesis, the development of skin cancers. We also know that the development of skin cancers based on data, based on our own clinical experience, that it is, especially in fair-skinned individuals, this is strongly correlated with exposure to sunlight in outdoor activity, as well as from professional and recreational exposure. So this is already a well-known fact to all of us, and the excessive sun exposure in terms of the side effects already is well established. We also know that by practicing photoprotection, we know that exposure to sunlight, exposure to UV is a very modifiable factor in decreasing skin cancer. That is the reason then when we talk about photo protection, this is the entire package that we all know, how we educate our patients, how we educate the public. That is, clearly, we have to tell our colleagues, we tell our patients, we tell the public that, there are a lot of advantages to outdoor activities. We should encourage people to participate in outdoor activities, but to practice sensible photo protection. And the package is shown here. That is to seek shade when you're outdoors, to wear photoprotective clothing, including wide brim hats as well as sunglasses. As you know, nowadays the photoprotective clothing are quite light and quite comfortable to wear. But as importantly, an integral part of photo protection is to apply sunscreen, at least an SPF 30 or above, and we should use broad spectrum sunscreen to cover not only UVB but also UVA protection liberally. And also, if you're outdoor, if you participate in outdoor activities, or if you sweat, then to apply it every 2 hours when outdoors. So this is the entire package that we need to tell the patient about. Sunscreen is an important component of this photo protection strategy. So this study involved a very large number of surveyors, over 50,000 interviews that was conducted from January and February of 2023. So this is a very recent data covering a total of 20 countries, as you can see on the right-hand side, and the countries all over, literally from all over the world, among representative samples of the population age 16 and older in each country. So it's a very broad spectrum of study involving individuals with different skin type living in different parts of the world. Let's see what the result is. The result is quite interesting, actually. And then one of the questions that was asked in that survey is that whether they have sun exposure between 10 to 4 p.m. We all know that that is the time when UVB exposure irradiation is the strongest. And in fact, almost 50% of the individuals say, yes, I did go out, I did get exposed to sun exposure between 10 to 4 p.m. If you look at the left-hand side of the figures of the bar graph, you could see the darker blue is male, the lighter shade is female. You can see for all categories across all parts of the country, Africa, Asia, Europe, North America, and South America. Men tend to be exposed more frequently as compared to women. Again, when you average them out, that's about 50% have sun exposure during that period. If you look at on the right-hand side, so men is more common. If you look at on the right-hand side, this is the data that is divided into age groups. You can see 16 to 34, the blue, and 34 to 54, 35 to 54, the gray, and the light blue is 55 or above. You can see the younger age group tends to get more sun exposure as compared to the older age group. You can see that by 55 or above, the number of exposure, the percentage of exposure is less compared to the younger age group, and this is true across all parts of the continents. So knowing that, then the next question that was asked, why are public health messages that we all know, that we all preach, we all tell our our patients about, are not respected? And these are a very interesting answer. You can see on the left-hand side there, it is the most convenient time for many of them to go outside. That's the reason that even they know that this is a very time that has a lot of strong exposure. They still want to go out because it's more convenient. More pleasant hours is the next one. They have busy lives, so the hours available is between 10 to 4. That's the reason they went out. And then if you look at the lower part of the graphs, you can see did not understand the message, do not believe in prevention message, and lastly, very small percentage do not know why, but I do it anyway. So clearly there's a lot of gap in terms of education that we need to do to make sure that our patients and the public would practice the photoprotection appropriately. Then in terms of applying sunscreen every 2 hours when outdoors, only 24%, almost a quarter, say that apply sunscreen every 2 hours when outdoors, so meaning 75% of them, they did not. So let's take a look here, and you can see that across all the continents, Africa, Asia, Europe, North America, and South America, overall, they are only 25% on the average apply sunscreen every 2 hours. It varies a little bit based on the continent, but overall that is the case. So again, if one look at men versus women, you can see that women are much more compliant in applying the sunscreen every 2 hours. You can see the percentage in men definitely less as compared to the percentage of women who apply sunscreen every 2 hours. Again, this is consistent across all the sites that were studied. This is breaking down by age, just like before, and I showed that the younger individuals tends to be less compliant, and this is the case also, that you can see that as one gets older, that there are less people who apply sunscreen every 2 hours when outdoor. So let's take a look as to why, the reason why these about 75% of individuals do not apply sunscreen every 2 hours. You could see from the left, product is too expensive, too tedious, not useful, doesn't occur to me, I just don't remember it, and not aware of this recommendation. But it's again showing that there is significant educational gap between what we know that should be done versus what the public and our patients are doing. So the next question was asked, why do they protect themselves in terms of why do they practice photoprotection? Clearly, almost more than 1/2 of those individuals, both men and women, know that they apply sunscreen is to avoid sunburn. I think that is quite a well-known fact, and in fact, this shows that many of the individuals, many of the patients know that. But then, if you look at the next few graphs, to be able to spend more time in the sun, because of the history of sunburn, and then more interestingly, as a protection against skin aging. So photoaging clearly is a very important one. In fact, if you look at the last set of bar graph, protection against the risk of skin tumors, skin cancers, is less as compared to protection against skin aging. So in other words, people protect themselves, they apply sunscreen, more of them protect against photoaging as compared to protection against skin cancer. It's still quite high, but still photoaging is higher as compared to protection against skin cancer. So in terms of protection against skin cancer versus photoaging, this shows again what I have just mentioned. This is based on the 3 different age groups that we have mentioned. Fear of skin aging is greater than fear of skin cancer. To avoid sunburn, you can see on the left, the vast majority they knew are both younger as well as older individual, more time in the sun because of the history of sunburn. But then you can see that the second to the last set of bar graphs, acceleration of skin aging is one of the strong reasons why they protect themselves. And the risk of skin tumor is less as compared to acceleration of skin aging. In other words, the perception and the practice of photoprotection for many is more important to prevent skin aging, less so to protect skin cancer. They still know about skin cancer, but skin aging is still a very important component why individuals would protect themselves against sunlight. So with that, then I would like to give the summary and as to what the conclusion should be from this study. The survey, again, as I said, this is a large number of individuals, over 50,000 from 20 countries, and it shows that 47%, almost 1/2, still go out in the sun at the hottest time of the day, between 10 to 4. Not only it is the hottest time, but it is the time, as we all know, where UVB is the strongest during that period of time. Clearly, the risk of sunburn, the risk of photocarcinogenesis, especially for fair-skinned individuals, is the highest. And then 76%, three-fourths of the patients did not apply sunscreen every 2 hours because they don't think about it or they do not know about the recommendation. Again, this is our responsibility as physicians, as dermatologists, I think, to try to continue to educate the patient about it and how to tailor the message. And then in terms of the price, 1 in 5 people that is an important component. However, 3 times more common in Africa than Europe. In other words, many of the people who respond to the survey in Africa found that it is to be price is a limiting factor as compared to Europe. Not completely surprising because of the economic differences between these 2 regions, of course. So the second part of the summary, which is the last part, which is compared to the risk of skin cancer, skin aging seems to be a more relevant concern for many of the individuals who participate in the survey, particularly among the women and particularly about people living in this part of the world in Asia. Definitely more common because of the development of, for the concern for development of photoaging changes as compared to skin cancer. The short-term impact is also more relevant. Using sunscreen to prevent sunburn is 50% of the individuals that say, yes, I use sunscreen because I do not want to get sunburn. And then in Africa, it's up to 60% almost, and in South America, 56%. So depending, I think, the region of the world, there's some variation, but overall about 50% wanting to avoid sunburn. Clearly, based on all this data, which is, I think, very, very important, because no matter what we know, the important part is that how do we educate the public, how do we educate the patients? We have to get their perception. So this is the important part of this study, that it shows that the public, that their perception is one thing, what we know is another thing, and we need to try to merge those two so that we can appropriately communicate our message to the patients, to the public, so that they can practice what is appropriate, and tailoring for the protection, public education message clearly needs to be done. So, thank you very much.